Okay. Sorry, it's 4 o'clock. Shall we start?
Yeah, sure.
Are you ready, Ram?
Yeah.
Your slides are ready now. You can share also by the time.
Yes.
I will give the introduction. Right.
Sure. Sure.
Yeah. Good evening. Myself, Professor D. Karthikeyan, Principal, SNS College of Pharmacy and Health Sciences, Coimbatore, and convener for this session. On behalf of SNS College of Pharmacy and Health Sciences, I feel honored to welcome the today's speaker, Dr. Siva Reddy, State Authorized Chief Administrative Pharmacist, Tostrup Pharmacy, Denmark. And I welcome all the participants to this today international webinar. Today is the second day. Yesterday we had a webinar on Teach to Reach the Lung Protection and Quality Control presented by Dr. Durairaj Tyagarajan, Research Associate, Helmholtz Institute of Pharmaceutical Research, Saarland, Germany. Now, let me introduce the today's speaker, Dr. Siva Reddy. He was awarded PG in Pharmacy under the Tamil Nadu Dr. Ibia Medical University, Chennai, and College Gold Medalist in Master of Pharmacy. He is also the recipient of Nana Sebastian Charitable Trust Award for the year 2019-99, 2000 as overall outstanding students in Master of Pharmacy. And Dr. Reddy pursued his Doctor of Philosophy in Pharmacy from the University of Helsinki, Finland. After completion of his PhD, he continued collaboration with the Social Pharmacy Department in University of Helsinki, Finland. From 2001 to 2008, Dr. Reddy served as Executive Secretary, SEER Farm Forum, FIPWHO Forum of National Pharmaceutical Association in Southeast Asia region, New Delhi, India. His function involved in coordination with the National Pharmaceutical Association in implementing WHO pharmaceutical care policies and preparing guidelines, setting up standards, leading projects, conducting training and seminars, symposiums for pharmacy practice development in Southeast Asia region. Dr. Reddy has also worked with the Park Davies Pharmaceuticals in India. He has 18 national and international publications and made several presentations and professional congresses. He is currently working as state authorized chief administrative pharmacist at Tostrup Pharmacy, Denmark. Once again, on behalf of all of you, I welcome Dr. Siva Reddy, and he is going to present a webinar on pharmacy practice and pharmacist services in Denmark. Thank you. And before hand over the session to the speaker, my dear participants, please send chat messages if you have any queries. Thank you. Dr. Siva Reddy, it's your time. Thank you.
Thank you, Dr. Karthikeyan. Thank you for conducting the series of webinars and inviting me to present the topic. And I'd like to thank the chairman, S.N. Subramanian, and correspondent Dr. Raj and Nalini, Vimal Kumar, technical director, and principal Dr. Karthikeyan as well, and BT madam for coordinating, and Lalit Mukesh for contacting me to conduct this session. It's interesting to share my views and experience and how we are doing the pharmacy practice here in Denmark, and what are the services that we are providing to the patients. These are the things that I'm going to talk. I myself, as Dr. Karthikeyan said, I'm working here in the community pharmacy as Chief Administrative Pharmacist in Tostrup Pharmacy. It's a community pharmacy, and we have several branches. We will talk in detail about three things here today. what is the system here in Denmark, how the pharmacies work, what is the pharmacy practice, how the pharmacy practice is working here in the country, and what are the regulations, what are the price regulations, and how the country is managing to distribute medicine to have the access to all the patients, how the pharmacy network is existing in the country, and as well as what are the services that the pharmacies and pharmacists are providing to the citizens. Now let's come to the topic, facts about Denmark. Denmark is a small part of the Europe, and it has a small area of 43,000 square kilometers. And there are 5.7 inhabitants, citizens, that is 5.7 million, which is very less than Tamil Nadu population, if you see. Just to compare, what is a pharmacy in Denmark? It's a part of primary healthcare system, which means the government and the Ministry of Health has recognized the pharmacist and the pharmacies as the primary healthcare system part of the healthcare professions. It's not just in the books, but it is also in the implementation, in the practice. And it's very in-depth regulation, regulated by the ministry and the FDA, that is Danish Medicines Agency, and the Ministry of Health and Interior are regulating this. And it's a licensed business like anywhere else in the world, but the pharmacy owner has to be the pharmacist. Only all the pharmacies are owned by pharmacists. No businessman or no any other profession can own the pharmacy. That is the very strict regulation here. And all the licenses are owned by the state, but the pharmacist will acquire the license, and the state will decide how many licenses have to be in the country, based on the limitations, like how many citizens are in one particular area, how many pharmacies are in one particular city. You cannot just open a pharmacy when you think it is possible. The state has to go and approve it. The proprietary pharmacists can own up to 8 pharmacies. That means you get one license, the owner will get one license, and there will be opportunity for opening 8 small branch pharmacies around within the 75 kilometers of the radius from where your main pharmacy is operating. The owner is both economically responsible as well as operational wise. The owner pharmacist has to take the responsibility for these things. And then what are the regulations? The gross profit of the pharmacy is regulated, which means how much a pharmacy would earn will be regulated, because all the transactions, including the OTC and the creams and whatever you sell in the counter registered, will be registered with the state, and these things will be sent to the regulatory authorities, and every year they will monitor the sales, and they will see the growth of the pharmacies and see the margins and how much they are earning. Everything they would see, and they will make the regulations of the profit regulations. And the owner associations are strongly involved in these negotiations. Prices are controlled centrally. The pharmacy, whatever the pharmacy sell, all the prescription medicine will be regulated by the state. The state will set the price limits no matter what it is, and they will receive all the price codes from all the manufacturers. And once they have them, they will publish the prices, and the pharmacy has to import the data from the authorities automatically they have to implement these prices. And these price changes, price regulations will um, happen every fortnight. That means every 14 days, every alternate week, there will be a new prices for all the brands that are available in the in the in the in in the systems. Suppliers set the prices. They will set the prices. How much a manufacturer will set the price of one particular brand. For example, if you take a simvastatin from Sandoz, it's a generic one. They will set the price and inform it to the authorities 2 weeks before and say, okay, from week 2 to week 4, these are my prices, and this is going to be what is my price. And all the pharmacies are obliged to sell it only at that price, and the cheapest brand, the cheapest generic price will be quoted, and the citizens have to be offered only those prices to the prescription medicine. Equalization among the pharmacies. This is one of the very interesting thing. Easy access to medicine for all the citizens. This is the main goal. And to avoid closing down of the pharmacies in rural areas and remote areas, the pharmacy will go and take the equalization system. That means the pharmacies which are earning more will share their turnover. And because if you see here on the slide, there are considerable differences in turnovers. There are pharmacies in rural areas which has only 15 million Danish kroners, and the big pharmacies, large pharmacies, have a turnover up to 145 million kroners. So this is the equalization system is helping the entire pharmacy to make the prices competitive and exist in the systems without closing down the pharmacies in the rural areas. Pharmacies have another important thing, that is medicine price system. As I told you earlier, all the medicine prices in the country are managed in the and it will be the same in every pharmacy, and purchasing price is set freely by the manufacturer, and the pharmacy markup is also set by the government. And there is 25% VAT on every medicine that is being sold, and reimbursement of patients only for the cheapest generic prices. Prices are liberalized on OTC and freely regulated, and that means OTC prices can be different, and the pharmacies can set their prices on the OTC medication. Regulation of prices are fixed, and in the entire Europe, if you take all the countries, Denmark is providing the, if you see this slide, Denmark